Right now, our COVID-19 command center remains in red status as the number of patients hospitalized with COVID-19 continues to grow in our hospitals. We have more than 450 inpatients with COVID-19 in our Spectrum Health facilities. Some 1 in 4 COVID tests that our team administers is positive. This has stretched our resources and has wide-ranging implications for our system and the community. Spectrum Health West Michigan President Dr. Daryl Almushi is here now to give us an update. Dr. Almushi, thank you. First, can we start with just an update, if you can set the scene for us as to what's going on in our hospitals?
Yeah, I think as everyone's probably heard by now, we are incredibly busy. And I always feel a little like the boy who cried wolf, because I say, boy, it's unprecedented. We haven't seen it like this before, but this is absolutely true. As of today, we have well over 450 patients in our hospitals with COVID-19, and that's on top of huge numbers of patients with non-COVID needs. It's stretching our staff thin, it's stretching our beds thin, it's stretching our supplies thin, and it's just heartbreaking to see all these people with COVID-19 in the hospital, on the ventilator, and even dying.
What kind of impact is it having on us operationally?
We have gone to what we call red status, which is something that we didn't even know existed a couple of years ago, or even maybe a few months ago. And that essentially has said that all hands are on deck. We're focused on COVID and caring for our patients and our team members. We're trying to expand capacity daily. We're unfortunately deferring more and more care in order to care for people that are coming into the ER and in our hospitals. It is stretching everything thin.
We've brought in the Department of Defense to help us deal with some of our staffing concerns. Is that something you could have ever imagined that we would need to do?
Quite honestly, no. With that said, if I could give them all a hug right now, I would. The Department of Defense is sending a little over 20 folks, doctors, nurses, respiratory therapists, here to help our teams care for more patients, and it couldn't come a moment too soon. We're incredibly grateful, and we need them.
One of the impacts this is having operationally is on surgeries, especially elective surgeries, and we've had to defer some of those. Can you speak to that?
Yeah, and this saddens me, and I'm sure so many others. At the end of the day, people need care. And we learned early in the pandemic, when everything was shut down, that deferring a lot of that care can be bad. Not only emotionally challenging for folks, but actually lead to physical harm. We've gotten much better, and we're very focused on what we can safely defer and what we can't. With that said, we've deferred hundreds and hundreds of surgeries and other procedures really over the last couple of months, but very much so in the last few weeks, because we need to. We need to make up space to be able to care for these COVID patients. We need to have staff to be able to care for more and more patients. And so it's been really challenging, and I wish we didn't have to do it. We're trying our best to find when we can fill people back into the schedule, but for now, this is the norm.
And at this point, we haven't even felt what might be more of a surge from the holiday gatherings that likely happened last week.
Yeah, quite honestly, what keeps me up at night is the fact that in all prior surges, both here and quite honestly everywhere else in the country, we've seen numbers go from very low to very high rapidly and then come down. What we've all seen here in West Michigan over the last few months is this gradual climb for a number of months to a pretty high level, and then suddenly a sharp upswing about 2-3 weeks ago. And the concern there is that everything is still going up, and in the middle of all that, we had Thanksgiving. And everybody wanted to spend time with their families, of course, but it was cold, it was indoors, and we just don't know what to expect in the coming weeks. I can't wait, and I'm sure most of the viewers can't wait until we see these numbers come down. We just don't know when that'll be.
There are a lot of folks who feel somewhat helpless as we see these numbers continue to rise. Our team members are working hard in response, and they still continue to rise. What can folks do, our team members, members of the public, what can they do to help in this situation?
Well, I'd start by saying, I thought about this a lot. In war, our members of the armed forces are heroes. We know they're there to protect our rights, our liberty, our lives. Quite honestly, our team members are the same. I've been rounding a lot lately at all of our hospitals, and to see the work that they're doing day in, day out, on Thanksgiving night, 24/7, it's amazing. And the one thing that everyone can do to help, and this sounds so silly, and I know people are sick of hearing this, is get vaccinated. We've looked at our data left and right, up and down. We look at it every day, every week, and the one absolute constant is that the vast majority of the people that are sick enough to need ER care, hospital care, ICU care, and actually who die are unvaccinated. And so as of today, 87% of all the inpatients in our hospital with COVID-19 have not had vaccine. And what I mean by that is they haven't had the 2 doses. We're not talking even about boosters here. We're talking about the initial 2 doses. And if people would get vaccinated, if we can get more of the population vaccinated, we still will have COVID-19. People still might get sick, but the number of people needing our hospital care and dying is going to go down dramatically. So if you could do anything for our team members and for the public, it would be that.
I want to ask you about the scene in our hospitals. I think unless you are one of the patients that's there or one of the team members that works there, you may not understand what that means when we talk about being at or beyond capacity. Can you tell us what it's like inside the hospital?
Yeah, you know, I'll start with emergency departments. So our emergency departments are made to see people, take care of people, and if someone needs to be admitted to the hospital because they're sick enough or injured enough, we see them in the ERs and then hopefully relatively quickly get them to the appropriate room upstairs. Because the hospitals are so full and we're seeing so many people in the ERs, on a given day we have 10, 20, 30, 50 patients across the emergency departments we run in our emergency rooms who have already been seen, admitted to the hospital, and are actually sitting in beds in the ER waiting for beds upstairs. This includes ICU level patients. That's not a good place for anyone to be as far as having to wait. We have very good care we can provide down there, but that backs up everything for people coming to the ER for other reasons. So that makes it really challenging for all of us, for patients, for providers, and so forth. In the hospitals, everybody is stretched. We're all doing the best we can, but when you have hundreds of patients instead of dozens of patients, you have to make do, and that's what people are doing. I'm very, very grateful to everyone, and I'd say that for those people out there that really question how serious COVID is, I only wish I can give you a tour of our ERs in our hospital. I guarantee you'd leave here saying, COVID is real, COVID is a problem, I'm going to wear a mask and get boosted or vaccinated if I haven't.
How much more can we take? I mean, we talk about this number continuing to rise.
Yeah, you know, we very purposely haven't set a finite number. When we talk about our capacity, I can tell you today our ICUs are running at 140% capacity. You could ask me, well, what's the limit? We don't know our limit. We haven't set a limit because we are here for the community. Particularly being the largest health system on the west side of the state, if we suddenly shut our doors, we'd have people dying in the streets, quite honestly. We can't have that. We won't have that. So I tell you, what's our limit? We're going to go as long and hard as we can to care for everybody. My hope is that it'll turn down, get better, and hopefully by the holidays things will be on the downward spiral. I just don't know if we'll be there yet.
We've heard a lot of talk about this new variant, Omicron. What can you say about our reaction to that and any concerns about that coming to our doorstep?
Yeah, well, I can start by saying that we're living with Delta now, and Delta is not a good variant. Delta is very transmissible, as we've seen. The news coming out of South Africa and other parts of the world are that Omicron potentially is more transmissible, which would clearly not be a good thing, meaning it's easier to catch. What we don't know yet is if it's more virulent, meaning does it cause worse disease, and we're hoping not. Delta, it turned out, didn't, so that's a good thing. And then obviously one of the biggest concerns is, might it be able to evade immunity, meaning might it be able to evade vaccines and prior infections protection, and we just don't know yet. Time will tell, and we hopefully will find that out in the next few weeks. With that said, it's obviously causing everybody a whole lot of concern, and at this point, I think it's best not to panic, wait for the data, but we'll all have to be prepared because it'll surely be here before long.
Of course, we all, and I know you're included in this, pay attention to the reaction our information is getting from the public. And one of the responses we hear, unfortunately, all too often, is just questioning the veracity of the numbers we're putting out, some supposing that we have some incentive to not be truthful in those numbers. I want to give you a chance to respond to those concerns.
Yeah, you know, I have to say, you have to have a pretty thick skin to be talking about all these things out in public, because while I believe the vast majority of the public absolutely understands the predicament we're all in together and supports us, the caregivers, everyone else, there are some folks out there that for whatever reason, and I can't understand it, always seem to find some fault. Those numbers aren't real. COVID isn't real, the vaccines are dangerous, and I have to say that is all absolutely false. I couldn't say more, and even if you looked at motives, the motives of a healthcare system are to take care of people, take care of our community. Right now, we're deferring care. We're deferring care that we want to perform because we're taking care of COVID. This is not something any of us chose to do. This is what we're here to do. So I will tell you without a doubt that that is incorrect and false, and I'd love to have a conversation with any single person that questions the veracity of our data or what we're trying to do.
And you know, we talk a lot about the number of lives lost, about the number of people who are hospitalized with COVID-19 in our hospitals. But I also look at that number on the dashboard, and I saw just recently it crossed 10,000 recoveries, people who have been able to walk out of our hospital. Can you talk about that and what great work our team is doing to get us to that number?
Yeah, I love that number. So we've celebrated our numbers of vaccinations before when we crossed the 200,000, then the 400, then the 500,000. But really, when you think about what we've impacted and who we've impacted, something amazing is that we've taken care of, across all of our hospitals, 10,000 people that came in acutely ill that could have even died with COVID-19, and we've nursed them back to health, and we discharge them home or to somewhere where they can recover even further. That's an amazing feat, and that's because of everybody here and the love that everybody has for our patients. So I think that's a great milestone. I don't want to see it get to 20,000. I really don't. I think we could be done at 10,000, but we've done great work.
We've been encouraging our team members for longer than I think any of us ever imagined to stay strong. We're all in this together, and for some, that stay strong ability is wearing thin. What do you say to those team members?
Yeah, you know, I think about this all the time. I ran one marathon in my life, and it was incredibly hard. And I was around mile 20, and I was about to die like everybody else who runs a marathon the first time. But I knew I had just over 6 miles left to go, and I knew the end was in sight, so I made it. The challenge for all of us now is we don't know when that end is in sight. I think most of us feel like we've been running a marathon and we're now on mile 50 when we thought we might have been done at mile 26. The only thing I can say is we're all doing this for a higher calling. You know, I think all the time how lucky we are. We're in healthcare, we're here to help people, and we're needed now more than ever. At some point this will pass. At some point COVID will become endemic like the flu, and you just got to hang in there. We're here to support each other. I wish I had some magic words to say that will make it better. It won't, but we'll get through it together.
For more information about COVID-19 and how it's impacting our community, including a look at the dashboard that's updated regularly with the number of patients being treated at Spectrum Health, be sure to visit spectrumhealth.org and search COVID-19.